Hi, my name's Cheryl and I'm a community midwife working in Whitley Bay. I want to talk to you a little bit about home births. So home births is an option for every lady. Normally recommended for low risk women. However, if you are classed as high risk, if there's any problems in your pregnancy, you may have to speak to your midwife or consultant-led team to make sure there's a plan in place to ensure the safety of both yourself and your baby. Home births are fabulous. So your oxytocin, which is the hormone that helps you labour well, thrives in a home environment. So familiar sights, smells, sounds, which you will get at home. So often women labour really, really well at home. When you first go into labour, what we would want you to do is time your contractions so we know how often they're coming and how long they're lasting. And you would ring up birthing centre just like you would if you're going to come into the unit. The birthing centre coordinator would have a little chat with you to assess you a little bit over the phone, and then if you feel like you need a community midwife to come out and assess you, we would then come out and do that. Depending on what we find and how you're coping at home, either a community midwife will go home and leave you for a little bit longer if you're not quite in established labour yet, or we would stay there with you and take you through the labour. If you were to have a home birth and you wanted to know about your sort of pain relief options, we can give Entonox, which is more commonly known as gas and air, and also a lot of women who have a home birth decide on having a pool. That has to be arranged by yourself and your family, and you kind of monitor the water temperature yourselves, but we can give you advice and help on how to keep that safe and in a good temperature for both you and baby. Sometimes things don't go as planned. The community midwives who come out to look after you are very experienced in home births, and if there's anything that we may be concerned about, we would discuss that with you, and if we sort of wanted to transfer you in, we would talk about that and maybe make a plan to do that if we were concerned about either yourself or your baby. So just because you decide to have a home birth, there may be problems throughout that we need to refer you to the unit for. There might be no concerns at all. However, you may think, actually, this isn't for me. I'll need a little bit more pain relief, and that's absolutely fine. You can be transferred into the unit if that's a decision you make. Statistically, home births are as safe as giving birth in a hospital for a low-risk woman. And also, if you are transferred into the hospital, you are statistically less likely to need pain relief, etc. when you come in. So if you are wanting a home birth, you can decide to have one we would like to know before 36 weeks, because we would need to come out and do a home birth assessment. So we need to make sure that your home is a safe space for you to give birth. There's lots of little different things that we look at with regards to the safety of you and your baby at home. So if you just let your community midwife know, and we'd be more than happy to talk to you about that.